Assalamu alaikum dear students. Today we will discuss most important MLT MCQs part 1c. The most specific test for HIV is option A ELISA, B Western blot, C VDRL and option D Vidal test. So the correct option is B Western blot. Explanation is Western blot confirm HIV infection after a positive ELISA screening test. Normal adult platelet count is option A 20,000 to 50,000 per cubic millimeter, B 50,000 to 1 lakh per cubic millimeter, option C 1 lakh 50,000 to 4 lakh per cubic millimeter. So the correct option is C 1 lakh 50,000 to 40,000 per cubic millimeter is the normal range for adult platelet counts. Normal platelet count range 1.5 to 4 lakhs per cubic millimeter. Subscribe now and press the bell icon. Never miss an update from a technologist. So creatinine is excreted mainly through option A liver, B lungs, C kidney and option D skin. So the correct option is C kidneys. Creatinine is filtered by the kidneys and serves is a marker of renal function. The stain for fungal element is option A gram stain, B KOH mount, C Zidane stain and option D James stain. So the correct option is B KOH mount. Explanation is 10% KOH dissolved tissue debris, clearing the view for fungal hyphae. ESR is measured in option A milligram per deciliter, B millimeter per hour, C cells per cubic millimeter and option D milliequivalent per liter. So the correct option is B millimeter per hour. So this is the unit of ESR measurement. Explanation is ESR is the distance in millimeter. Red cells fall in 1 hour. So this is very important MCQs. The Vidal test detects antibodies against option A hepatitis, B typhoid fever, C tuberculosis and option D HIV. So the correct option is B typhoid fever. The Vidal test measures antibodies to salmonella antigens and typhoid. Benedict test gives which color if sugar is high? Option A green, B yellow, C brick red and option D colorless. So the correct option is C brick red. The higher concentration of glucose turns Benedict's reagent brick red on heating. So this is very important MCQs. The bacteria causing tuberculosis is option A Mycobacterium tuberculosis, B Salmonella typhi, C Staphylococcus aureus and option D Vibrio cholera. So the correct option is A Mycobacterium tuberculosis. Explanation is TB is caused by AFB, specifically Mycobacterium tuberculosis. Which vitamin deficiency causes bleeding tendency. Option A, vitamin D, B, vitamin K, C, vitamin B1, and option D, vitamin E. So the correct option is B, vitamin K. Explanation: vitamin K is essential for synthesis of clotting factors. Dear students, this is very important MCQs. The protein estimation method is option A, Jeffries method, B, Biuret method, C, Benedict test, and option D, simple blue test. So the correct option is B, Biuret method. Biuret method is based on peptide bond reacting with copper ions to give a violet color. Leishman stain is used in option A, CSF analysis, B, malaria parasite detection, C, bacterial culture, and option D, stool examination. So the correct option is B, malaria parasite detection. Leishman stain is suitable for peripheral smear, especially for malaria. Urobilinogen is detected in urine by option A, Benedict test, B, Ehrlich reagent, C, sulfosalicylic acid test. So the correct option is B, Ehrlich reagent. Ehrlich reagent form a red color with urobilinogen. Bile pigments in urine cause option A, greenish color, B, reddish color, C, yellow form, and option D, cloudy appearance. So the correct option is C, yellow form. Presence of bile pigments in urine gives yellow form when shaken. Red stain is used for option A, bacteria staining, B, blood smear staining, C, urine sediment staining, and option D, fungal culture. So the correct option is B, blood smear staining. Red stain differentiates blood cells and peripheral smears. The normal fasting blood glucose level is option A, 50 to 70 mg per deciliter, B, 70 to 110 mg per deciliter, C, 120 to 150 mg per deciliter, and option D, 160 to 200 mg per deciliter. So the correct option is B, 70 to 110 mg per deciliter. Normal fasting glucose falls between 70 to 110 mg per deciliter in healthy adults. So RPR test is used for detection of option A, hepatitis B, option B, HIV, option C, syphilis, option D, malaria. So the correct option is C, syphilis. So explanation is RPR is a non-treponemal screening test for syphilis. Eosinophilia is most commonly seen in option A, bacterial infection, B, viral infection, C, parasitic infection, and option D, anemia. So the correct option is C, parasitic infection. Eosinophilia increase mainly in parasitic infections and allergies. The causative agent of whooping cough is option A, Bordetella pertussis, B, Corynebacterium diphtheria, option C, Haemophilus influenzae, and option D, Neisseria meningitis. So the correct option is A, Bordetella pertussis. Explanation is whooping cough pertussis is caused by this gram-negative Coccobacillus. So this is very important MCQs. The test used to measure urea in blood is option A, Jeffries method, B, diacetyl monoxide method, C, Biuret method, and option D, glucose oxidase method. So the correct option is B, diacetyl monoxide method. Explanation is this is a colorimetric method specific for blood urea estimation. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. The enzyme elevated in Mycobacterium infarction is option A, amylase, B, alkaline phosphatase, C, KMB, and option D, lipase. So the correct option is C, creatinine kinase, CKMB. Explanation is CKMB isoenzyme releases during heart muscle injury like MI. Which anticoagulant is used for glucose estimation? Option A, ADTA, B, sodium fluoride, C, heparin, and option D, sodium citrate. So the correct option is B, sodium fluoride. Sodium fluoride prevents glycolysis, preserving blood glucose level. Thank you for watching my videos.